Western media and many of their representatives in countries like India keep showing the poverty in India, the unhygienic parts of India. They don't show the kind of hospitals we have, the health facilities we have, the standards of hygiene we have, and the facilities we have, which are really up to date. Actually, there are facilities which we have in India, which the FDA in US has taken ages to uh, give license to, and hence many times we have the latest facility which is not available in US. I can say that from personal experience of managing some patients.
A very good evening, ladies and gentlemen. Welcome to Swarajya Conversations. I'm your host, Sharan Sethi. I'm privileged to be joined by Dr. P.S. Venkatesh Rao, who is an endocrine surgeon, and he also writes on a number of issues, including geopolitics. Um, and Today, I'm joined by Dr. Rao to be discussing the outbreak of monkeypox virus even in India. Dr. Rao, thank you so much, sir, for joining me today. I hope you're doing well.
Yeah, thank you. Hope all of you are also doing well.
It's a real privilege to have you here. First of all, the many of these diseases are contained in a particular geographical location, and it does not transmit to other continents. But in the case of monkeypox virus, we've seen that, and I think this is the sixth public health emergency of international concern that's being declared by the WHO. What's the reason behind this? What's your analysis, sir?
See, this monkeypox was known for a long, I mean, for more than 50 years. It had been found in monkeys which were being used as experimental animals, and hence it got called monkeypox. It is uh, similar to the smallpox virus, different from the chickenpox virus. And it was the repeated outbreaks started after 1970, and they were all in Western and Central Africa. And this problem didn't spread outside this area. But now, suddenly, this year, we have started seeing cases all over the world. Started with especially in Europe and in US, and now it has appeared in India. We have 4 confirmed cases till now, 3 in Kerala and 1 in Delhi. And uh, we would you would be wondering why suddenly it has broken out of Africa, which didn't happen all these years. Uh, One, if you, as you realize, after COVID settled down, there has been a massive rush to travel, especially to exotic places, to places which were not originally popular. Secondly, getting visas in some of these popular destinations have been difficult. So likely that this kind of traveling to uh, places where were not traveled very often before may have enabled this infection to spread out to the other parts of the world. The other thing that I feel, the other reason I feel is that after smallpox was eliminated, smallpox vaccination was also stopped. So some of the younger generation may have never been either exposed to smallpox or had smallpox vaccination, and hence would be vulnerable to this infection. Third, the initial cases were all from a particular population. These were men having sex with men, and hence there was this initial comparison with AIDS and its initial spread. But now we know that it is spreading by both contact with these people, with those who have infection, or with contact with their clothing or the linen or bed sheets, etc., and also to some extent by aerosol spread, which was not initially noticed. That means if the blister powder, the blister and the scab they form, if any dust from that becomes airborne, then the air spread. And some of these patients are also having cough, dry cough. So increasingly now it is being felt that we need to take precautions against airborne. So these are all things that are happening. These viruses are not known to mutate as often as the COVID-19. So these viruses are far more stable than the coronaviruses.
Right.
Hence,
And is there
the
a need to be concerned?
the smallpox vaccine is still effective against them.
Right. And since India has actually witnessed multiple cases now, what's the level of concern that the government should have or the public should have in general, and what are the precautionary measures you would advise for common people like us?
Yes, we need to create awareness. That's why I'm happy that you are conducting this interview. And the idea is to create awareness, not panic, but awareness. And get people to realize that if they get fever, body ache, etc., it may not be the common viral infection. It and especially if rash and lymph node swellings appear, then lymph nodes are like the police stations of the body, and you have them in various parts of the body, especially in the neck. Now, if you get these swellings and maybe some sore throat and cough, then do be aware that you may be having this problem, especially if you have traveled to Africa or had contact with someone or traveled outside. So you need to go and get a screening done. Now, the hospitals and all of us medical professionals have been instructed by the government of, by both WHO and now by the government of India, that we should also be aware that these monkeypox cases may be occurring in India, and we need to screen these cases, isolate them, test them, and triage them. And especially if there are risk factors and severe disease.
So thank you so much for that answer. But I have to ask you, in the past, or at least in the recent past, we've seen multiple diseases and health outbreaks actually being reported, which have been declared as a public health emergency of international concern. This can be Ebola, Zika, H1N1, and the recent COVID-19 virus. And monkeypox actually happens to be the sixth PHEIC declared by the WHO. Why are we witnessing so many diseases of late, sir?
One, as I said earlier, the international travel has gone up markedly. I mean, countries like India, China, and other very populated nations, people from there have started traveling in large numbers. Previously, it was only the privileged people from who could afford international travel. Because of competition between large number of airlines, the travel costs came down. People started traveling a lot in the last 20 years. Secondly, a lot of countries started promoting tourism as a source of income, including many of the poorer countries. They wanted the African countries and various other countries started promoting tourism. That meant people landed up in places where you had all these exotic animals and wild animals. So and also various exotic cuisine were also introduced, and people went and uh, landed up interacting with wild animals and wild bush meat. The chances of zoonotic infections, most these are all zoonotic infections. There is a suspicion that, I mean, uh, quite a few of us are convinced that COVID-19 came out of gain of function and other biological research, so that is also a cause. But the rest of them have been all zoonotic infections. That means infections which spread from wild animals to us. So the more we interact with wild animals, enter their space in the forest, and the greater is the chance that it will spread to the human being. And then, of course, the humans can spread it from one human being to the other. And the COVID-19 highlighted the risk of trying to do genetic engineering with viruses, trying to make them more infective, of course, with the claim that it is for the sake of preparing vaccines for the future, but actually got also the military also got involved in certain nations in developing biological warfare weapons. So this only increased the risk to all of us of
Right.
these infections.
So many of these diseases, and earlier it was with HIV/AIDS as well. There was a lot of stigma around it because people in their own cultures started seeing individuals infected with a lot of these diseases in a certain worldview. There's a lot of stigma around people who actually, get infected with the monkeypox virus, especially because it spreads in a certain manner. So, as a medical professional, how would you advise people who are not seeking treatment because they're stigmatized? What would your outreach message be?
First of all, the Indian government has activated the mechanism which was in place to manage AIDS. And there is already a mechanism, a network, and they know the target population. So through that, which is discrete rather than something which will broad public um, stigma to them, the Indian government is already active in that. They have already activated the mechanism. Secondly, the WHO has advised that all such people be asked to avoid sexual activity when they are infected and to use condoms and other barriers for at least 12 weeks after their full recovery. So, this is a message which is being uh, disseminated to the already known target population. And this is
Right,
what is being done so that these people, without public outcry and uh, any kind of discrimination, they can be
right.
reached out to and advised on these things. And if
So,
they
and what's
get
the
infection, to
future?
be isolated. Yes, please.
Right. What's the future trajectory in
Yes.
terms of the transmission rate for monkeypox virus? Is there any amount of good data available as of now, or what's your prediction, sir?
Monkeypox has started spreading out of Africa only for the last 2 months. It's too early to say, but the infectivity rate is definitely less than most of these viruses which caused pandemics, like the influenza virus and the coronavirus. We did observe that Ebola and the AIDS virus didn't spread as fast as these other viruses. So it is not that all viruses will lead to a pandemic. Some the influenza and the coronavirus are airborne and hence and are far more infective. So we have seen much more spread of those viruses leading to pandemics like the H1N1 pandemic, the SARS pandemic, etc. But if you notice, Ebola has not spread the way because it is by contact, it is not by airborne. There's a lot of difference. If it is airborne, it is much more infective. But here, like with
Right.
droplets and aerosols can spread. And hence, all of us health workers and those taking care of such patients have been asked to use mask and take precautions against airborne infection to us.
So my last question is before we sign off. You wrote an article recently about medical tourism in India and why foreign patients actually prefer India. Now that is quite a leap from the kind of characterization India received abroad. That it was very unhealthy and there were a lot of public hazards, health hazards in that sense. What are the arguments that would actually summarize what you're trying to say, that foreign patients actually prefer India for medical treatment? Why would you say that?
What happens is the Western media and many of their representatives in countries like India keep showing the poverty in India, the unhygienic parts of India. They don't show the uh, kind of hospitals we have, the health facilities we have, the standards of hygiene we have, and the facilities we have, which are really up to date. Actually, there are facilities which we have in India, which the FDA in US has taken ages to uh, give license to, and hence many times we have the latest facility which is not available in US. I can say that from personal experience of managing some patients. Secondly, many of these patients in countries like Canada, New Zealand, Britain, etc., land up in long waiting lists, and especially for major surgeries. And they find it much faster to come to India and get the surgery done. And the Indian surgeons and other doctors have far more experience than these Western doctors. First of all, because we have one sixth the world's population, and hence we have one sixth the world's medical experience. And the Western nations, they have limits on the number of hours any doctor or any professional can work, and hence, and they give long waiting, appointments, long distance appointments, so that their experience is a fraction of the experience that an average Indian doctor has. And the international patients have started realizing it, that we have more experience, we have some of the best equipment, we have the hospital facilities, and of course, the many of the doctors here speak. I mean, most of the doctors here speak English, and the nurses and the hospital staff. That is a plus point, considering that English has now become the international language. That is also
Right.
helping us. And the cost, which is often mentioned, it is often far cheaper for them to travel all the way to India and get their surgery or their treatment done. It may be a transplant, it may be a cancer treatment, etc., and go back home. Even the drugs, India is the cheapest place for drugs. There have been a film produced in about an Australian who was uh, taking cancer drugs from India to Australia. There was another movie in China of a Chinese who used to take cancer drugs from India to China. And of course, there was a hue and cry after that in China. But they have uh, all realized that the drugs in India are much cheaper. So you have less hospital expenses, you have less hotel expenses, travel, you can travel, stay in a hotel, get your treatment in the hospital, have a holiday in India, and have the cheaper drugs, and then get back home healthy and happy. And I have personally operated on patients from South America, New Zealand, Russia, and South Korea. So it's not just NRIs, and it's not just uh, patients from neighboring countries like the Gulf countries and Asian countries. We are getting now patients from around the world, from every nook and corner. And the internet has also helped them locate us. Previously, when there was no internet, it was very difficult for them to find suitable doctors and medical facilities. It's much easier for them to find us here in India. So we are get that is also a contributing factor to the increasing tourism. And I would also like to add
Right.
that some of the poorer countries um, find it certain amount of racial discrimination when they land up in Western countries, not from the doctors, but from the while traveling to those countries and staying in those countries. So this helps. Uh, these are the various reasons where medical tourism is really taking off. And if we have various other regulatory things like the medical visa, which does take some time, if the government can look into these things, and I think it'll be much even more tourists will come to India. And
Right.
the
These are
media like you could show successful cases and happy patients before they go back abroad.
Oh, absolutely. If you would be very kind enough to connect us to such patients who can actually narrate such stories or tell us their experience of coming for medical treatment in India would be more than happy to display and exhibit their cases to the larger public.
I can
Uh,
mention two cases if you have the time.
okay.
One lady,
Yes.
a Russian,
Yeah.
married to a American, both of them ultra rich. She was a corporate lawyer, international corporate lawyer. She is actually an international corporate lawyer, and her husband is an international investment banker. And she was having episodes of unconsciousness. And he ran around getting various doctors to check it out. And the diagnosis was never correctly made. Then he used his experience as a paramedic when he was in US as a youth, and thought that whenever he had an emergency to answer on a diabetic, invariably they would be unconscious like she was and having fits. So he decided to check the blood sugar and found the blood sugar low, and then made the got the rare diagnosis of insulinoma made. And uh, then, when they contacted various leading hospitals in Europe and in US, they found that they insisted that a major part of the pancreas will have to be removed with a lot of adverse effects uh, after that. So he did an internet check, found that found me, who had experience, one of the world's biggest experiences in laparoscopically removing only the tumor and not the major part of the pancreas, rang me up and then came over. She had the successful surgery, and she got a visa for 2 weeks, but she was back in 5 days. And they have sent me images later on of the successful surgery. So they have come for our capabilities, not because it was cheap for them. At the same time, a New Zealand doctor who was given a 6 month waiting list to see the surgeon, he's himself a doctor, and he's given a 6 month waiting list. He came over, we correctly diagnosed, gave him the treatment, and sent him back within a few days. And so he has been also fine. So one person came because of the our capabilities. Another person came because of the waiting list. So there are many other such cases. There was a lady who came all the way from Bogota, Colombia, for a very critical surgery, which very few places in the world there is the ability and the experience to handle it. So there are many such cases which come. It's not just for people think that people come just for a bargain hunting. It is not that. There are a lot of capable surgeons and physicians and chemotherapists and dialysis people and various other facilities, chemotherapists, etc., who are in India, who are among the world's best. So we should really promote medical tourism.
This is extremely heartwarming to know, Dr. Rao, and I hope such stories are brought out to the public and more people visit India, not just for normal tourism but even for medical tourism purposes, because we have such
Hello.
facilities in the future. And thank you so much for putting those stories out to the public, and in an attempt to at least change the mischaracterization of India in the Western press that you mentioned, which I thought was very important. Thank you so much for joining us today and giving
Hello.
us your time, and I hope you can join us again in the future.